Hello, I'm Veronica Campbell, physical therapist and owner of Integrated Manual Physical Therapy. This is the lumbar section of the posture series that I'm doing. And just remember, all of it's connected, so hopefully each different section gives you a little bit of information that can help you. But please know when I talk about the cervical spine and our forward head posture, how much our low back plays part of that. So having a good base of support makes everything above it easier to find the right alignment. So playing with chair height is nice. Sometimes you get stuck in work scenarios like me where I'm working remote right now, where you have to adapt things as best you can. Or for example, on a long car ride or plane ride, how can you make that environment the best to support your back and posture? So one piece that's really nice that you can do and play with, and it's very simple, it can be a towel or a sweatshirt or something, is to put underneath your sit bones. And so this isn't covering the whole chair, it's the back half so that it's underneath the sit bones, so it gives you a little bit of support on the pelvis to tip you forward. And so what that happens is that little bit of support allows me to have my weight on my pelvic floor and my tripod base rather than slouched back. But you can still slouch back some. So what's nice then is to meet that with a pillow. So you can put a pillow into the low back, and different sizes work for different people, so that you start to have something that gives you that base of support underneath the back half, right, the sit bone, so your pressure's on your pelvic floor. Now your back is supported, so you can work here. Now let's say this is still not enough, or you're getting achy, or you have a lot of tailbone pain or pelvic pain. There's a really simple, easy tool, and I use this on an airplane a lot because those seats are terrible. As you take a sweatshirt, a t-shirt, this is just a kitchen towel, and you roll it up and you make a horseshoe or a U shape, okay? And so then you're going to sit that, or place that underneath, again, your glute area and your pelvis and your sit bones, and then place the pillow there so that now it's creating some support to unweight your pelvic floor a little bit. So whether this is you had a tailbone injury or you're having pelvic floor issues, this really, and it's amazing how simple a little towel can really give you that support to your whole pelvis, so that now I have a much harder time slouching. And so as I, of course, work with the thoracic posture and my neck posture and letting everything soften, I can work, and it doesn't let me slouch as easily. So I have support all the way up. So that's one of my favorites for getting a correct alignment for your pelvis and low back to support the whole system. It's really important though, if you've been sitting for a while, whatever your limit is, 20 minutes or an hour, to get up and stretch periodically. And if you've been sitting for a while, it's really great to stretch out your hips. So there's an exercise called bottoms up that's great for the sciatic nerve and hamstrings. You can watch that video in depth and get all the details separately from this. What I'd like to show you now are some for the hip flexors and for the hips themselves. So a lot of us know about the hip flexors or the iliopsoas or the psoas muscle that connect the spine to the hips, and they can get very compressed when we're sitting for a while. So it's nice to stand and open that up. I like to open up the hip sockets a little bit by standing with your feet nice and wide. Hands are at your waist, that's your belly button level. Then slide them down and feel really where your hip creases are, or the hip sockets. And that's sort of underwear line. And so on this, I'm gonna bend one knee. So the knee I'm bending, the other leg, so this is my right knee in this video. I'm bending my right knee and pressing my hands in this direction into my left hip. And then I come back up and I switch. I'm pressing in this direction down towards the floor. So it's a very gentle hip glide. You're feeling a stretch maybe a little bit in your adductors or your inner thighs, and you're decompressing the hip socket or the femoral head, which can get very compressed in sitting. So I really like to do this one a little bit first, and then turn and do my hip flexors. So then what you're doing is you're turning sideways. So these are the headlights on your car. They're facing forward, right? My left knee is bent forward. You want to take your tail, so you can see this with my hands here, and tuck under. So you're not creating an arch in your low back. You're tucking under a little bit first to protect the low back, Headlights are forward, and then I'm just slowly bending and straightening my knee to start to get a little bit of stretch on this right hip flexor. If that's not enough, you can add the arms with that. You can leave them up, or you can bring them up each time you lunge, just to start to get a little bit more stretch. You can also inhale, bring them up, and even open up and close. And open up, so you're adding a little bit of rotation. When I do that, this headlight doesn't stay forward, it has to rotate a little bit. But again, it just depends on where you carry your tension. And then make sure you turn and do the other side as well, okay? So hopefully these can help you open up that hip area that's been compressed from sitting, to decompress that low back, because that psoas attaches into your lumbar spine. So I hope this helps.